Today we are presenting on a degradable birth control implant with integrating peptides.
So the clinical need for our product stems from the multi-billion-dollar business that the birth control market has. This industry is expected to be valued at $19.6 billion by the year 2020. Currently, 62% of Americans ages 15 to 44 are using some form of birth control, and this encompasses anything from condoms all the way up to implantable devices. Of this 62%, only 11.6% are using implantable devices. So with this large age gap and large room for growth in the future years to come, we believe that our device will be very successful.
Currently, there are two types of implantable birth control available on the market, Implanon and Nexplanon. Nexplanon is currently phasing out Implanon, and although these are available on the market, there are obviously still some current limitations. These implants can be placed beneath the skin of the arm for up to 3 years, but they do require a small incision for their removal. Fibrotic tissue ingrowth can occur in and around the implant, which requires a prolonged procedure that is more painful for the patient. The implant can also be placed too deeply beneath the skin, which can require a more invasive procedure and a larger incision. The implant can also move from its original insertion site and require X-ray or ultrasound detection to find its new location. And lastly, the product is palpable beneath the skin, and this can lead to permanent scarring and or bruising. Therefore, we determined that there is a need for a degradable birth control implant that does not need to be removed from the body after its usage.
So as you can see from our approach slide, we have a new implantable device. This device is comprised of a PLGA biodegradable polymer. This polymer will have a set degradation rate based off of the pH of the body. It will initially release 70 micrograms of etonogestrel as a burst release on the first few days. It will then follow zero-order kinetics and release between 25 and 30 micrograms from there on out for up to a year. So on the screen here, you can see that there are little bridges. These little bridges will be filled with a fibronectin RGD peptide. This peptide promotes cell adhesion where the PLGA does not. So with this, we hope that this will form a thin band of fibrotic tissue in the center, which will allow for the device to attach firmly to the wall of the arm without being totally encapsulated by the fibrotic tissue. Our device is detectable by ultrasound and will not be able to be removed from the body due to the degradation properties. We hope that with future development, this device could be set for a longer duration of time.
The largest benefit of our product is that it is made of PLGA, a biodegradable polymer. This will eliminate the removal process, therefore making it more desirable to the customer. The RGD peptide will promote cell adhesion and will prevent the device from moving throughout the body. The insertion of the device is less invasive than an IUD. After insertion, there's an initial burst of etonogestrel, which will make the birth control effective immediately, and the patient will become fertile within a week of final degradation. Unfortunately, the current implant is very expensive, and it's possible that our device will be more expensive than this. Additionally, the device releases hormones to prevent ovulation, so there will be some side effects related to that hormone release. Because the device is degrading, it will be undetectable by touch, so while it shouldn't move, the patient has no way to confirm that it doesn't. Additionally, the RGD peptide will make fibrotic encapsulation possible, but this should not affect the drug release profile. Because it's degrading, it must last in the body for 1 year.
So as far as competition goes for the implantable market within the arm, there is two forms of implants. Both Implanon and Nexplanon are produced by the same manufacturer. However, Nexplanon is currently phasing out Implanon due to its ability to be X-ray detectable. Both of these implants can be used and kept in the body for up to 3 years. However, they can be removed before that 3-year span is up in order to reinstate fertility at an earlier time. Theoretically, these implants should be detectable by touch within the underside of the arm while in use. However, these implants have been known to migrate into blood vessels and have sometimes even wound up in the lungs. When the birth control implants migrate, this causes for a very invasive surgery to remove the implants and provides a lot of side effects and possible complications. Another form of competition is an intrauteral device. These are inserted into the uterus. There are two types. There are hormonal and non-hormonal. Both can be used in spans of up to 3 to 5 or at the most 10 years. These types of implants can also be removed before their duration in order to reinstate fertility. However, within their period of use, they have been known to shift and migrate and perforate and damage the walls of the uterus. The final form of the competition is the hormonal pill. In order to be effective, these pills must be taken every night to be effective. So while the pill is not necessarily invasive, it is a hassle to potentially have to remember to take it every night. We hope that our implantable birth control device will address the issues within the competition.